So my final question on this is, on April 3rd of last year, after a month earlier having mocked mask wearing, he said on 60 Minutes, during a pandemic, you do not want to be wearing a mask, as we hear there. On April 3rd, he said, when he finally did so, he emphasized, I say facial coverings and not masks because we want to save them for our healthcare workers. Why not just issue that the first time instead of saying that is some Asian shit, which is basically what he said on 60 Minutes. Now, again, what you're realizing is that the pro and anti-Trump folks have created this sort of dynamic where they create filters for the information they hear. Dr. Fauci is likely the most important factor in the defeat of Donald Trump. I see that clearly, and I give him credit. Even though I don't trust him, I think Fauci's as big a con man as Trump on this. But he did out media Donald Trump. He was able to, for the first time, deconstruct and deactivate Trump's ability to dominate the media cycle, to turn everything into what the media would depict as his victory. The reality is that for 4 years he's actually been losing because, he lost a little bit of ground with white men, but more importantly, he created massive turnout against him. But Fauci's the first person to consistently convince MSNBC and some other places to stop pretending that he's winning every time he says something stupid. The problem with that is that now the people who embrace Fauci, the people who embrace the COVID-19 regime, because it did get rid of Trump, they not want to let it go. Because if they let it go, then it proves what Trump supporters said, which is COVID-19 is only as deadly as it's only as deadly as it needs to be to get rid of Donald Trump. So you're seeing a double, and I'm not questioning that it's deadly. I'm not questioning that it's a problem. I'm not questioning that there are people who are deadly sick from it. But what I am questioning is this idea that you're sure the mass work based off the healthcare workers. You're sure that these public health officials are the basis for this confidence in the in this universal mask. I see all these people walking around with masks on, walking around everywhere with masks on. It just it it's just weird. You know what I'm saying? I don't know what else to say. It's weird and it's forced. I mean, it's not because people want to do that. It's because it's mandated by people, and yet it's according to your metrics, you who embrace the COVID-19 regime, it's getting worse. So it's not working. So you've created this narrative of this inconsiderate person. I heard people saying I yell at people who don't wear masks or I fought them. You don't know that the masks work. Okay? I don't know that they don't work. I'm not saying that I know that. I'm saying that the basis that they've given for them, when the CDC, World Health Organization, Surgeon General, Chicago Medical leader of Chicago Medical, and the makers of the mask say that you don't need to wear it. And then all of a sudden they all switch on a dime. It looks very strange. And Dr. Fauci's explanation for all this doesn't make sense. A couple days later, Fauci's up at the podium and he's not wearing a mask. And a young lady asks, "Hey, you just told us all to wear masks. Why aren't you wearing one?" And his response was, well, I want you wear a mask to keep you from infecting you," which you know what I'm saying? It was like sort of You could tell he wasn't prepared for that. And then he says, well, I get tested, and I tested negative. Again, COVID-19 regime people like, see, he tested negative. Except the problem is that it's already been stated that it's possible for you to not only be infected and have a negative test, but to be contagious and before the test picks up the before the test picks up the particles, which already makes comparing um, case numbers and positive numbers from different places pretty much not valid in terms of determining where they are, because you don't know what percentage of the people who are infected are in that stage that the PCR test can't pick up. But when Dr. Fauci at this press conference wasn't wearing a mask, he gave an answer that was repudiated by a case that claimed that a person infected a bunch of people on the plane because even though they tested negative, later on a bunch of people tested positive and they were sitting next to him. And of course, they said, well, those people tested negative too, but if they tested positive, it was this particular person who got on. I don't know how they would decide if all of them tested negative, why that one person is the one who's guilty. They don't know. They just made it up because there is an interest in alarmism. It's working. But the bottom line is his answers just don't really jive. You know, when he says in late March, this is late March, this is a few days before he switched and told people to wear masks, he said, we're not there yet, but once everyone gets, he's talking about healthcare workers, enough masks, then there's serious considerations about more broadening the recommendations. Well, that's not the science. He's not responding to a scientific change. He's actually saying, we're going to tell you that you need to wear a mask once we make sure all the healthcare workers get one. Well, that doesn't make any sense. Again, it doesn't make sense to say Donald Trump was a victim of voter fraud. And it doesn't make sense to say that you told people in the period which the fatalities were most dramatic up until recently. And there's some issues with that because many of these new fatalities are actually ones they're going back and finding and adding fatalities from, like, Missouri doesn't have 100 people dying. Missouri's having, it's still around 20 to 30, but they're going back months and adding them to modern totals, which honestly is just lacks all credit. Like, why would you do that? You know what I'm saying? That's why people are suspicious, because that's not the way you should be doing that. You shouldn't stick it on one day. That's intent to create a certain impact. But the issue is that when I look at these three questions, none of that makes sense. It doesn't make sense to say that he had to trick us into not wearing masks, but then he turns around and advocates a mask mandate because we won't wear masks. That doesn't make sense. Two, he advised against wearing any kind of masks, and yet professionals tend to wear N95 masks. So why would advising people not to wear cloth masks or any kind of masks affect N95 masks? Doesn't make sense. Three, when he finally did advocate for masks, he said, well, I'll say facial covering, not mask, because we need to save the N95 mask for our healthcare workers. Well, why wait till April 3rd? You know what I'm saying? He didn't say a word. In any of these, he doesn't say a word about asymptomatic spread. He doesn't mention asymptomatic spread. That's not the basis for it. He didn't mention asymptomatic spread in the 60 Minutes interview. So the bottom line is you have people who are fabricating justifications. You understand, Dr. Fauci is not operating as a scientist. He's operating as a public healthcare official. Public healthcare officials don't give you raw science. They give you justifications for desired public policy from the people in power from a healthcare perspective endorsement. That's very different. He's not actually giving you the scientific breakdown of how the the virus itself works. He doesn't really ever get into that. He just tells you, well, close this, you know, and he says things like close the schools, now open the schools. He says, well, Britain rushed their vaccine approval. Then he goes, oh, I shouldn't have said that. He's just a public relations guy. He's a person who's trying to construct a media narrative to get people to embrace something. And in the end, someone says, what's his agenda? He said what his agenda was. When he was talking to the British, he said, hey, Americans don't really want to have a dictator, but now it's time to do what you're told. That's his interest. He wants people to do exactly what he wants them to do. He wants people to do what they're told. It doesn't have to be a conspiracy. He now gets to be the most empowering person in the world, and he shouldn't be, because he hasn't done anything. Ask yourself one thing. What has he contributed? What has Dr. Fauci contributed to stopping the spread of COVID-19? There's literally no evidence that anything that he's done has worked at all. Period. There's no foundation to say any of the Fauci program. And yet he's being kept on by Joe Biden because that's how the bureaucracy works. He's been there for 40 years, and he gets to be the one who's defined as an expert. And that's fine. But the fact is that what he says to me doesn't make sense. And if you can defend that critically, that's great. But to say there's something wrong with our nation or something wrong with me for questioning that, that's where you have to start saying, wait a minute, what is this really about? What are the values about? And who are you trying to control? Thanks for listening. Until next time, this is the Gray Falcon.